right, so these are the 5 essential components to, really developing your manual therapy skills. You want to develop your manual therapy skills. These are the 5 components, right? Real big. Anatomy. Understanding the nature of tissue. So when it comes to anatomy, let's dig in a little bit. I often talk about anatomy as like when I teach in my manual therapy class, we go over surface anatomy and we go over applied anatomy, right? We are no longer in school. If you're a student, enjoy, but you're in a different phase, right? So I have people come to me, they're in school and they're like, but tell me more. And it's like, well, you have to go through school first. But when you go out into the real world market, you don't have to do school stuff anymore. I don't know if y'all people remember anatomy class and pathology class, but there was so much memorization and you had to know the ridge of where it was attached to on the 1/3 of the I'm like, please. And that's what they tested you on. In the clinic, you don't need to know that. So make your life easier and understand it for how easy you can make it for yourself. And that way you can make it easy for your patients, right? We're not doing research. We're not teaching in some academic class. And the only time you really need to dive into a little bit more detail is when you're studying for the CHC exam. But that's it. Right? So I encourage you to think about surface anatomy and thinking about applied anatomy. So when you think about applied anatomy, think about how things work. That's all it is. When you think about muscle, think about how muscles work. So I am teaching, or was in my in the mentorship program. I'm teaching about wrist this month, right? So if we're gonna look at applied anatomy, all you have to think about is like, okay, your wrist extensors. You have 3 main ones, right? You don't even need to know, right? Like, don't worry about the names, but they're just wrist extensors, and they start in the elbow and end in the wrist, and they extend your wrist. Applied anatomy is they extend your wrist. And you have your flexors, right? So you got to make it easier for yourself, but you have to then, from a manual perspective, know how to palpate them, right? So that's when you have to know that, a little bit more about anatomy, but applied anatomy just means that you know what they're supposed to do, right? So then the nature of the tissue. Understanding the nature of the tissue allows you to know what you're doing. Right? If I am touching on a muscle and tendon, right, I know that the meat of the muscle has blood supply, don't I? And I know that muscles get long and they get short. So wherever they started from, they attach their origin and they go to where they insert. They only get long and they only get short. They don't get wide. Right? They have that belly there and then it's attached to the tendon. So if you know the nature of the tissue, you know the job, you know what it's supposed to do. You know that muscle has blood supply, but the tendons do not. Right? So if you understand the nature of the tissue, not only does this allow you to know what to do, but it allows you to feel confident about what is safe. So if someone has a tendonitis, so in the mentorship program, we're talking about a lot of tendonitis, right? So people are like, well, I don't know what was safe. Well, did they cut the tendon? No, right? Tendonitis just means there's some inflammation. So what I know is I can reduce that inflammation, I can move the tissue in a certain way, I can feel confident that it's safe to do certain things. Let me know if that makes sense, right? It allows you to also know you can progress someone. So I'm using a very simple tendonitis analogy just to kind of help you, but you could think of a tendon as a laceration too, right? Flexor tendon lacerations. Well, if the tendons aren't, don't have blood supply to it, and it acts like a rubber band, gets long, gets short, if you cut it, what happens? That rubber band gets retracted back to where it started. So you have to actually fix that, and then it allows you over a period of time as you learn to know what you're safe to do, what you're not safe to do, how to progress someone, and how to really easily explain to your patients what's going on, right? It also allows you to understand surgery. So my explanations right now is a very easy way of explaining to my patients what's going on. And that's how I explain it exactly. I don't get really complicated. I remember when I was studying for the CHT and I would talk to my patients very technically. I didn't understand the glazed look that was over their eyes at that moment in time because I thought like I was a shit and that I knew my stuff and they were going to be so impressed with me, right? Maybe they were, maybe they weren't. I don't know. They were just like, can this woman shut up and just fix my hand? You know, but here I was thinking like, oh, I know, and I want them to know that I know, but it doesn't have to be that complicated. And now when I explain things, one of the things that people say to me is like, oh, that makes sense. People used to never say that to me. So I take clues from what people say to me, like, oh God, that makes sense. So when I explain it to my students and they're like, oh my God, that makes so much sense now. Or my patients say, oh, that makes so much sense now. I know I'm on the right track, right?